So before we get started, I'd just like to thank our co-sponsors for this event. That's the Health Law and Policy Clinic at Chilpie, the Harvard Health Law Society, and the Harvard Food Law Society. So thank you to them. And if you've seen from our email bombardments, this is the second of our three-part speaker series. And we're really trying to focus on topics that have been routinely covered in the news again and again recently. So our first event was on ultra-processed foods. This event is obviously about the Dietary Guidelines. And our third event is going to be about a new class of medicines, GLP-1s like Ozempic, that are having a profound impact on diet-related diseases. So today we're really fortunate to have Dr. Deirdre Tobias as our speaker. Dr. Tobias is a nutrition and obesity epidemiologist at the Brigham and Women's Hospital, Harvard Medical School, and Harvard T.H. Chan School of Public Health. She received her doctorate from the School of Public Health in epidemiology and nutrition, and her research focuses on identifying lifestyle risk factors and integrating, please correct my pronunciation of this, metabolomics.
Oh, I didn't do all that.
And the prevention of obesity and its related chronic diseases. Dr. Tobias' interests are in improving validity and the rigor of nutrition science research, optimizing systematic reviews and meta-analysis, and causal inference methods. And she also serves as a PI for several NIH grants and is co-instructor for the nutritional epidemiology at the School of Public Health. She also, obviously why she's here today, she served as a member of the scientific committee for the 2025 through 2030 Dietary Guidelines for Americans. And today we're going to be discussing the development of those dietary guidelines. We're going to dive into the details of that review process, how the advisory committee arrived at their recommendations, and the role of health equity in shaping this next set of dietary guidelines. Don't worry, we're also going to save 15 to 20 minutes at the end for questions and answers, so please hold your questions until the end, and hopefully we'll have a great discussion. So I want to get started really by just setting the scene and introducing what the advisory committee really does, and I think this was interesting to me. I think we can all agree it makes sense to have scientists and experts in nutrition and medicine evaluate the evidence on diets and dietary patterns in order to develop the recommendations that will ultimately end up in the dietary guidelines. What was news to me, and what I didn't know beforehand, was that those recommendations that the advisory committee puts forth they go through several rounds of review and revision by many federal agencies like the NIH, FDA, CDC, among others, and there are also several opportunities for public comment throughout the process. And ultimately, the U.S. Department of Agriculture and the Department of Health and Human Services are responsible for updating and releasing the guidelines. So my question for you, Dr. Tobias, is, again, it makes sense to have the experts being the ones evaluating the evidence, but what do you think the thought process is behind having this very comprehensive scientific advisory committee and review process? Evaluate the evidence, provide recommendations on that basis, only for those recommendations to be filtered through the political process.
That's a great question, and I don't know if I can give a succinct and all that insightful answer. But the process itself is mandated federally, and it's from the 1980s, I believe, around then, to be updated every 5 years. So there is a mandate for the scientific review to occur, to re-review the evidence, consider any new science that may have been published or come to light, and also new topics, right? So as we've seen different chronic diseases become priorities over the decades, those may have been more considered than they have in the past. So the update every 5 years from the scientific perspective is a process that's sort of established and in place with federal mandates. That translation to the dietary guidelines themselves, that's the more public and policy-facing document, is what you're describing, goes through these additional steps. So the role of the scientist is to conduct that review, to synthesize all the evidence, where the gaps are, where the certainty is, and sort of the degree of certainty for everything in between, to then formulate sort of what we should recommend based on the evidence for overall health of the population. And I don't know how different the sort of final guidelines versus report has been over the years. Anecdotally, there have been some differences in sort of themes being tossed out altogether. That's rather than kind of like shifting of the servings per day recommendations themselves. For example, I know a couple cycles ago there was initially sort of a charge that the committee was tasked with of looking at the impact of sustainability of the recommendations and climate impact that at that federal level was dropped altogether. So again, not necessarily the recommendation piece being manipulated or modified, but this other additional theme. There are also instances where sort of like the final federal version maybe reorders foods to prioritize certain agricultural investments higher on the list than others. So, you know, there's not science probably behind many of those decisions, and to what extent it's politics or, you know, other stakeholders and the influence that has. I mean, I can't speak directly to that, but that is clear that we're handing over science, and what happens after that is a non-scientific political level. So that's, but that is what we're charged with doing, is generating the scientific report. We put together what our recommendations would be. The guidelines themselves are meant to sort of endorse or essentially translate that for maybe more of like public consumption and what policies it could impact. But deviating too far from the science, I think is, I don't have too many great examples of that I know, but I'm sure there are some out there. But I think that would take a lot of sort of counter science, ideally. So I don't really know what influences are most likely to be at play there when that does happen.
Yeah, thank you for that. And I think you touched on something that I really wanted to touch on, and it's a nice pivot, I think, because you talked about the themes and notably the theme of sustainability ultimately being removed from the dietary guidelines in the past iteration of that. And what was really notable about this advisory committee's work was its evaluation of the evidence through a lens of health equity. And again, if you've been keeping up with the news, we're at a time when equity and considerations of, culture generally are really deemed to be at risk and definitely under increased scrutiny. So I think it's really important for us and you to help us connect the dots between, an individual's circumstances, how they were born and brought up, and the status of their, economic situation as well. The connection between that and the scientific evidence that ultimately impact the recommendations that you all make. So could you connect those dots for us and maybe share a little bit about the relationship between factors like economic status, race, and culture, the connection of that to dietary patterns and health generally?
Yeah, absolutely. So when the scientific review group, which I was on, comes onto the stage in this process, it's almost like halfway through the 5 years in between each next version. And the work that goes on leading up to the committee being formed is trying to identify sort of where the past committee might have suggested we prioritize next round, maybe because they couldn't get to it, or they recognized it as a significant gap and there was a call for researchers to start thinking about it more. So there's a lot of sort of like sifting through potential priorities that get handed off to the committee when we arrive on the scene. And one of them was this consideration of a health equity lens throughout the entire process. One of the first sort of big tasks was, what does that even mean, right? What does it mean to have a health equity lens as we're reviewing science? And so that was something I myself personally had to sort of figure out how that would be relevant to looking at epidemiology, or how that could, contribute to the conversation. And so there was a subcommittee that would participate in a lot of our discussions to help us as a group identify ways where that would be part of the conversation. Because we're looking at existing science that's already been conducted, right? We're not conducting our own research, which would be where we could, get creative and address many of sort of these bigger equity questions. So for a lot of the epidemiology looking, and also clinical trials, one of the ways that we sort of weighted the evidence with a health equity lens was looking at the demographics of the populations in the studies we're looking at, the extent to which they're even reported sometimes. But also, beyond just like sort of racial and ethnic diversity, looking at socioeconomic position and other factors that may be social determinants of access to healthy foods or education and whatnot. So those were all factors that we included in our synthesis when we would come to like the totality of evidence on a topic. Not just is XYZ good for you, but to what extent can we say that finding is generalizable to the broader US population versus really limited in the types of populations that have been studied so far. So I felt like more of the conclusions with this lens were that we need more research and less so in the area of, wow, we can say that everybody will benefit equally from this, because that was just a big gap we noticed throughout. So that's how we integrate it in the systematic review process, which is one sort of component along the way. Another was this really cool tool they started using with the USDA as part of our review process with data analyses. So we can look at sort of, there's this cohort or this study the USDA runs called NHANES. Maybe many of you are very familiar with it and others have not heard of it. But it's essentially this like cross-sectional survey that's meant to be a snapshot of a nationally representative sample of US population, and the N is nutrition and H is health. So that's what they're trying to basically get like a pulse on over time. So with that, we have good comprehensive nationally representative data on what people report they are eating. And with that, we can get a sense of trends over time, or how bad is it really? And it is bad. Nobody eats like the recommendations are suggesting. It's all, except for today's lunch, fantastic. And so that allowed us to look sort of, are there groups where there are disparities of sort of the healthy eating index is one way you can sort of give people a grade on how aligned their typical diet is with the dietary guidelines. On average, it's around 55 in the US, which would be a failing grade because it's on a scale from 0 to 100. And I found it actually quite remarkable that that was pretty consistent across populations. Knowing sort of the gaps in prevalence of obesity, diabetes, and some of the major chronic diseases across socioeconomic position and race ethnicities in the US, I thought there would be a much starker contrast in diet quality as well. And I feel like that maybe takes the pressure off the individual and almost is an indictment of our food supply. Because if a high socioeconomic status, high education subsets of the US are having the basically same horrible mean score as the rest of the population, then it's not, an intentional or behavioral reflection. It's more the population's food supply that we're all ultimately exposed to. So that, I think it's actually kind of enlightening, because I know we want to educate people on how to eat healthy, but I think the big takeaway for me personally was the food environment can't even meet us where we're at because of, people we would assume would be able to afford to eat more healthily aren't even doing that. So this data analysis piece was really useful. We also had the opportunity to pilot some data analysis of typical dietary patterns for native populations around the US, and I think only 2 tribes were reflected, so even that was like really, really pilot and not representative. But that will allow us, if this tool continues, to say, okay, if we recommend this many servings of all these things, what we'll do in the back end for the overall population is just make sure there aren't like nutrient deficiencies that we're introducing by saying eat more of this and less of that, right? So it's not necessarily with respect to health outcomes, but it's folate, okay, and key fatty acids and fiber. But we do that using the typical US population's diet, not more cultural specific diets for that input. So there's big assumptions then that we all kind of eat the same things, which obviously we don't. So with this pilot data, we could, rather than make vegetables be what the typical US vegetables look like, it could be the subgroup or subpopulation's vegetable intake, which obviously have very different nutritional compositions as well. So we were able to sort of pilot what it looks like to vary what the input in the background diet looks like based on different cultural eating ways, which was, again, not something we drew like strong conclusions for in our report, but more or less just, I think, going forward, we would endorse that as a really useful initiative to use.
Yeah, I really appreciate that. Again, I think most of us here, many of you may be scientists, but for the folks in the room that are, lawyers or policymakers, it's very, very helpful to hear about kind of the tools that you all rely on to comb through that data, and also counting steps in between from, observing a specific population and, the cultural preferences that they have in their diet, and ultimately need to take steps to make these recommendations apply to a broad population, which I think is not even easily said and definitely not easily done. So I think I want to drill a little bit more into kind of the process of evaluating the weight of the evidence, and you've talked a lot about it so far, but I think from our perspective, I'm just curious, what does it mean to evaluate the weight of the evidence on a particular topic or question? And I think I'm very curious about what were the hardest decisions to make, or maybe the most controversial, and where do you think the evidence on a particular type of food or dietary pattern was stronger in this research?
Yeah, so that's a great question. First of all, the entire process was on, I don't know, I haven't checked in a while, the USDA HHS website. So I think it's DGA something. But more or less, the infographics of every step of the way from the very beginning have been posted, and sort of how there's different types of evidence we're using in parallel and how they get integrated and what the protocols for all of these were all posted prospectively, and I think in the most transparent way possible. So you can dive into any of your favorite topics and see how we plan to address it, what shifts in that plan there might have been, which would also be justified and posted, and how the final report reflected that plan. So for the systematic reviews, which is probably the bulk of where we review the science in terms of, what patterns or foods are related to cancer, what patterns of foods are related to cardiovascular disease. For these, we first of all had to set our list of questions. And that was not an easy task. Again, we came in the middle of the process where sort of top priorities were already identified based on either trends in these outcomes or the last committee's guidelines, recommendations. And so we had this list of, Alzheimer's is something people really care about. Is there evidence about dietary recommendations for that? Other cognitive declines or diseases of aging. Looking, at healthy pregnancies and other sort of life stages that have maybe not been featured as heavily in past review processes. So we had this big list, but obviously you have to have research that's been conducted on that question or in that space to be able to review anything. So the next kind of key step in deciding what questions on this list to keep was this scoping review step. And the staff at HHS and USDA were phenomenal. They had been working since the last guidelines was published to sort of stay on top of the literature for all of these different health outcome domains. And so they presented with us sort of what they're seeing in the literature might even be available to help understand if it's worth tackling. And for some health outcomes, there really just is nothing out there on diet and its relationship with developing disease later in life. It's also important to remember that there are clinical guidelines for treating a lot of conditions, which is beyond the scope of what this is meant to be, right? This is meant to say, preventing broad spectrum overall health promotion and prevention of chronic diseases for all Americans would look something like this. So, if there are health outcomes where there's a specific diet or something to avoid or eat more of to treat a condition, that would probably fall in the domains of clinical guidelines that organization on pediatric cancer or something might put forth. So we have this list. The scoping reviews helped us sort of determine which were probably not feasible, mostly because there were just not enough studies published on the topic. And then also some questions had also been pretty conclusively addressed in the past, and revisiting it wouldn't change that conclusion because it's already at the sort of highest rank of strength that it could be based on past committee reviews. So the priorities ended up being more where there could be a bigger impact with the time that we had, either in sort of like solidifying the evidence because there's so much more now, or addressing something that's relatively new but has had a lot of recent research. And so what the review process is for systematic review on any one question is first determining, what types of studies we would consider. And for something like type 2 diabetes, you could imagine how many trials there are out there that are really short term, intervening with a diet just to look at changes in something like glucose. But we know fasting glucose is not in and of itself type 2 diabetes, right? So there were a lot of conversations around what types of surrogate endpoints, which is what randomized clinical trials tend to use, because they're not going to wait several years or even decades for a disease to develop. They're going to, have follow-up that's maybe months, maybe years for a few trials. And then if we, that's sort of more on the trial side, duration was a big sort of topic of debate. And then looking at the epidemiology, there's a huge range of quality in epidemiologic study designs. And what designs would we not even really consider because they may be so prone to certain biases that we would want to raise the bar and stick to the higher quality evidence. So once the protocols were all shaped out, we were then essentially leaning to our colleagues at the staff at the USA and HHS to run all of those little literature searches, extract all of the data, and then when it was presented to us, it was everything. So if we're looking at saturated fat and cardiovascular disease, it would be all the studies that have published on it, how the exposure was assessed, what the population was, the sample size, all of the factors that we had in terms of quality that we wanted to know, like what they adjusted for in their models, how diet was collected, how long was followed, and things like that. So really, it was just a lot of discussions about grids of data. When it was really unwieldy, we were all assigned subsets of papers to come back and describe and go into detail on. So it was kind of like, for me geeking out that was awesome. For other colleagues on the board, maybe not as much, but it was just really cool to see all of the data laid out, and where there were consistencies, which are reflected in our conclusions, it was just so obvious. And there are some areas of the guidelines where there just is such little debate that it's seems almost unbelievable that someone would believe the opposite, but they do, because we looked at everything. There was no cherry picking. It was the totality of evidence. If there's a handful of studies that don't see the same thing, why is that? And sort of like the real critical lens of looking through it all, to make sure that what we say about that data in a couple of sentences for each conclusion was really what we actually believed. So there, what direction, what foods, is it a strong association, is it modest? But then also this step of grading the evidence, right, was a big one. So this is a process where you sort of have quality scores for the individual studies themselves, but then look collectively. How consistent is it? Is it really consistent? Do you have a lot of studies kind of going in the opposite direction where there actually is more uncertainty? And sort of looking at the totality of evidence from how sure am I that this is right, is another whole process in of itself. So that's what was the grade type scale. So if you look at any of the conclusion statements, it'll describe what we said, XYZ is related to this outcome, and the strength of the association is, high or something like that.
Just a
In
quick
a nutshell.
follow-up. Yeah. Did anything surprise you, when you draw those conclusion statements and draw those connections between, a dietary intake of one component of the diet or another? Did anything surprise you in terms of outcomes? Around clarity of evidence or otherwise?
Yeah, so the dietary patterns and healthy dietary patterns for cardiovascular disease was one question we felt was already established. That no new, and by that I mean the last round's conclusion, the strength that they gave the evidence, essentially comes down to no new evidence will overturn this finding because it's so overwhelmingly consistent from dozens or hundreds even of studies. So the sort of dietary pattern of, whole grains, fruit, vegetables, low in red and processed meat, low in sugary beverages, lower in sodium, like that sort of core pattern, there's just not a lot that can budge that from a scientific point of view. So we instead asked whether sources of saturated fat, sort of like within this saturated fat question, were more or less relevant. And so it's asking the question a little bit in a different way, because we know guidelines around saturated fat, that's a nutrient, it's not a food. We don't go to the store and like buy saturated fat or not buy saturated fat. And so what foods it comes in may be relevant for your health, because there are many things in our diet that are important. So we looked at the sources, the food level itself, to see if there were differences across the food where maybe the emphasis could instead be made at the food level, like avoid these foods, and these are actually okay because maybe they have redeeming qualities or whatever. It was remarkable to me, first of all, that this level of detail in the science was available, because as with my research methods lens, there's nothing I hate more than just the millions of research out there that ask questions like, is red meat good for you? Because it's so painfully vague from a data analysis and interpretation standpoint, where I can't do anything with a study that compares red meat eaters versus non-red meat eaters, because I don't know what the non-red meat eaters were eating in place of the red meat, right? So you have sort of this lack of information on half of what your estimate's telling you. If it's refined carbohydrates, maybe red meat looks pretty good. If it's plant-based proteins, red meat looks worse. So that contrast, which is what all trials in Epi are telling you, this group versus that group matters. So I was pleasantly surprised at how many studies, and mostly in the trial literature, explicitly compared different types of either sources of saturated, fatty meats, or plant sources of saturated fat, which is coconut oil and things like that, versus butter, where we could actually look through these one-to-one, head-to-head comparisons and draw some meaningful conclusions. Mostly that animal sources of saturated fat was really where a lot of the risk was. For some of these plant sources, there just is not really enough data yet. They're not as popular, so they're not as widely as consumed, at least in the US. But more research would be needed to really know if, just because it's plant, does that mean that saturated fat's healthier? I don't know. So I think the verdict's still out on some of that. But
yeah, thank you for that. Again, I think it's we love, as the general public and especially non-scientists, love those vague questions because it gives an easy answer.
Yeah.
Obviously questionable what it's relying on, but we love that because it will tell us what we can or should do, but totally understand what it actually takes now to get a clear answer. So I want to pivot just a little bit because we've been talking a lot about the kind of internal mechanism and workings of the advisory committee, but just in light of the new administration and particularly HHS Secretary RFK's emphasis on improving the health of Americans, we've heard a lot of critiques about the advisory committee, and a couple that come to mind for me are discussions about the lack of focus on ultra-processed foods or conflicts of interest between the members of the advisory committee and maybe some food industry folks. So I'm curious, first, do you think these critiques are actually valid? And why, if so, and why not if you think they're just maybe blown out of proportion right now?
Yeah, so the critiques around ultra-processed food were back 2 years ago, even when we were faced with this list of questions and whittled it down. So that was, not even this administration, that was, I guess, Biden era decision making. And that, even though, again, we're 20 scientists sitting in a room and I would argue there's probably not a lot of politics happening at that level, but the decisions around ultra-processed foods were essentially to not review the literature. And that was not a unanimous decision. I can't even recall how it was decided that those would sort of fall lower priority. We did retain one question, and that was ultra-processed foods with respect to the outcome of growth, body composition, and obesity. So that would be like weight, waist circumference, which would be central obesity, and then sort of like obesity, yes, no, so those types of outcomes. But not cardiovascular disease, diabetes, cancers, and chronic diseases that are related to obesity. I was very disappointed about that personally. I thought that this was not something to punt another 5 years. And having the ability to review it at this like platform would have been, I just think, a really timely move. And so for the question that we did review, we concluded that ultra-processed foods are likely to be related to obesity and weight gain. So there could have been like some meaningful conclusions to draw. And yes, the literature is mostly epidemiology, but most of the questions we review are mostly epidemiology. So that in and of itself was not a limitation, I felt, was really strong rationale. And then what was the other half of your question? Conflicts of interest. Okay, so we do disclose when we are onboarded or like special government employees. This is an unpaid role entirely. And we fill out sort of, I guess, whatever standard conflicts of interest form is involved with that. So they published a composite list, was how they wanted to do it that way. Typically, I think it's just not even made public what the members' conflicts of interest are. Although a lot of it you can just look in our publications, because we'll disclose what's relevant for that publication. You can look at a different publication, see what conflicts might be relevant there. But I think the public in the past has requested this to be more transparent, just to know sort of what conflicts there might be in the group overall, which is what I think ultimately got posted. But there was also additional requests to see at the individual level, like who specifically is being funded by XYZ, which I said could be sort of gleaned from other sources if someone really wanted to. So I don't know, I think I have mixed feelings about conflicts of interest, or at least perceived conflicts of interest. I think in nutrition science, we're already paranoid enough, most of us, of not being affiliated with food industry if it's going to undermine our credibility as scientists, right? And for those that do engage, you can almost take the opposite tactic of just like getting funding from everywhere, so you can't be accused of favoring one side or the other, which I think is what your next speaker's take is. But as scientists, we do increasingly now so have to diversify where our research funding comes from. And I don't know what that, how other committee members may have rationalized that for themselves and to what extent they perceive it to be a conflict of interest or what. I can only really speak for myself, but, I think one of the key questions in sort of the interview process that we had that I really liked and resonated and just stuck with me was, if presented with evidence that goes against what you believe now on that topic, would you change your mind? And I think that is like essentially the heart of a conflict of interest. If you don't answer that honestly, yes, and you're clinging to your preconceived notions for a reason other than science, then that's a conflict of interest. And it could be because you have close funding ties with that industry. It could be because you have a direct financial gain based on what the decision of that is, which would, I think, be probably the most extreme form. Or it could just be because, you have decades of a reputation as a scientist in carbohydrate quality or something, and having all these books out there that are now like, debunked because the science has evolved. Like, I don't know what it reputationally, whatever. So I think there's a lot of ways that scientists may have bias in their ability to objectively look at the science. And so I think that's a real concern. And that's like the biggest threat, is when people can't look objectively at the science and change their mind. So it does bother me when the current administration already has plans for what their guidelines might look like, but the review hasn't happened, right? Because it should be what the science leads them to conclude. If that science hasn't been reviewed, I don't know how the conclusions can be reached. So that's, again, if the science is not compelling enough to sway you, because of your preconceived notions, that's a problem. I don't know, again, I can't speak for the other members of my committee to whether any of them were in that sort of situation where maybe they would have had a different opinion or encouraged something slightly differently. With respect to ultra-processed foods, that typically would be something like the food industry or the beverage industry that would be stakeholders there. And I know that we all tried to be scientists at the table, but I can't really speak for others on that. I myself do not have any direct ultra-processed food industry funding, but I think trying to diversify what our research looks like these days, it's probably only going to get messier as a field, with NIH having less certainty in terms of where we get our research priority funding from. But yeah, it's complicated.
Yeah, no, I appreciate the candor, and also just, I think everyone should be a little bit more willing to change their mind in the face of evidence presented. So just appreciate you echoing that. I just have one more question for you before we turn it over to the audience, but this is really about, again, just translating the work that you all have done on the advisory committee to, what can we do on our end, in your mind, as lawyers or policymakers or fellow scientists to promote behavior change or dietary change in line with what you all found in the review process?
Yeah, that's a great question. I think it's clear from the process that we're looking at the science, not necessarily the implementation of it, right? So that translation of, okay, here's the guidelines, now how is it going to impact policy and access to foods or school meals or whatever, is all out of our hands at that point. I do wish we had more awareness of what the impact would be, not because it might directly reflect the science and what we say about it, but there were some discussions that we had, and this was public, it was recorded and maybe even still viewable. There was one conversation where we were looking at the ratio of carbohydrates in the diet, which right now is, grains, which is 50% whole grains, which means 50% refined, right? And that's sort of what we have consistently seen as something we want to minimize. So why is it still 50% refined grains? There's no science behind that number. And so I was sort of pushing our committee to have this discussion about making it more whole grains. And why we're clinging to this half refined, because that's a lot of refined grains every day when you look at it. And the answers that I was getting were all policy answers or food science answers that we didn't have anyone in the room to help us understand. And again, the 50% wasn't science-based, but our guideline, our review was, the science was very clearly suggesting more whole, less refined. Maybe we couldn't put a number on it, but at least shifting that seemed to follow the science. So one of the big questions, again, we had this cool modeling tool where we could input and look at nutrients on the back end that all these foods sort of contribute to. One nutrient we saw when we sort of modeled that shift towards more whole grains was folic acid. And folic acid is fortified in the food supply, and it's fortified in refined grains. So when you reduce refined grains on a population level, you may expose the population to nutrient deficiencies like folic acid, because it's artificially fortified in these refined grains. So my question was, why are we not fortifying whole grains? Why are we only eating refined grains or recommending them to get a multivitamin? I think that seems ridiculous. But nobody really could answer the question of what are the policies around fortification, and what is it logistically even feasible to refine to fortify whole grains? It probably is, because they're still industrially manufactured. So there were instances where I felt I would have loved to have that someone or a group of people at least present as an immediate resource, because discussions died off because of things like that, where it may have been a really simple, obvious policy or FDA fix or something like that. You know what I mean?
Yeah, absolutely. And
Yeah.
you touched on this a bit earlier, just saying, I think when we were discussing the health equity lens, like it led you to believe it's something to do with the food environment rather than individual behavior a lot of the time. So I think us as food lawyers in this room, or at least interested in that, are always thinking about what can happen at the FDA level, what can happen at the USDA level that, you know, brings us toward a food environment that actually enables people to eat healthier and access affordable, healthy food. So just want to, thank you for that discussion and being super candid with us.
Course.
And I want to open it up to you all for your questions as well. Who's going to be the brave soul to start? Nice. I'm going to give you this.
Hi, I'm Kelsey, and I'm coming mostly from the health law space. You were talking about how there are a lot of articles entitled something along the lines of, is red meat good or bad? And they are obnoxious. Obnoxious in terms of the science. For me, they're obnoxious because I get a lot of news alerts that no one can agree whether I should be drinking red wine or coffee or a variety of other things. I think that sometimes how it feels as a member of the public who is not in any way a scientist is that no one can agree on what's good for me or bad for me. I don't think I'm alone in feeling that way. And that's really not something I'm deeply concerned about, but I am concerned about the content, about the idea that this could get people to question the validity of science. Not just, and how we make choices in our everyday lives based upon science, not just nutritionally, but also like coming from the healthcare space, things like vaccines or stuff like that.
Yeah.
But there's this big question of trust in authority figures, trust in science. And I think for a lot of people that the changing sort of advice on nutritional stuff, which isn't probably coming from bodies like the one on which you serve, much more from these like studies that are very buzzworthy. Is where that's coming from, at least in part. I'm curious your sort of reactions and responses to that as somebody who's trying to be very responsible and studied and reviewed in scientific advice.
So that's a great. It's just such like a huge area of nutrition media that I like cringe at every single day. I agree. I don't know. I think there is first of all, we all have to eat every single day, right? So this is like food could not be more personal. You have to wake up and eat something. And I think the reason we can't say is something good or bad is because it's all relative, right? We're not talking about like giant toxic whatever, like it's all food and something, and we want variety. We need variety because there's nutritional value across the board that we have to get from all these different areas, which is why there's food groups and we need a little bit of all of them. But there's no sort of, don't list and do list that you can just live by and be fine because it's all relative, right? If you, like the red meat example, like refined grains may actually be worse for something like diabetes than red meat, but red meat is significantly worse than like plant-based protein. So it's all a spectrum as well. And so where you're shopping in the spectrum may matter in terms of, healthy versus unhealthy. I get the public's kind of like frustration and the headline whiplash when it comes to diet. I don't know that it's like coming entirely from scientists, although there are certainly scientists you can pinpoint as saying, like loving the controversy and wanting their study to be in that headline. But I do think, when we look at something like the systematic review process or whatever, no one study is going to tell us what is good or bad anyway. So when there's headlines about one study, that's just clickbait and media and, the sort of like the abuse of the press, in my opinion. But then there are, headlines or like the Time magazine, if anyone even reads that anymore, I don't know, about like butter's back and things like that, and like eggs, as bad as cigarettes, or are they? All these sort of, things that we villainize and then redeem and then villainize again. I don't know what drives a lot of that. I think it's just really easy to get like a flashy news headline when anything diet related, because again, we all have to eat, and if there's something we shouldn't be eating, oh, I should know that. Or if there's something that is going to help me like lose 20 pounds, I want to know that too. So I think it seems very natural that those would be attractive headlines in the media, but it does. I do think I agree it undermines the credibility of the science that is there, that isn't as flashy and is, eat at the produce aisle when you can and not really all that attractive or, as quick of a fix as people probably want. But I don't know what to do about it. I'm not like a influencer or an advocate or anything like that. I'm just a scientist, so I can just be equally as frustrated as you. I don't really know what can be done about it at the end of the day. But if anyone has ideas, I'm all ears because it's, yeah.
Students, okay.
All right, I'll come back to you.
Thanks.
There you go.
So you mentioned at the end there, a reference to multivitamins. I'm really curious, what is the attitude in the food policy space on things like multivitamins and supplements? Like obviously it shouldn't be necessary to have those things, but is there a camp that pushes for that kind of thing?
So I mean, first of all, the wellness and dietary supplement industry is like trillions of dollars. It's above and beyond pharmaceutical in many ways. I think that's like a whole nother scary internet place in my mind. Sort of the pushing of different supplements, but with the asterisks not intended to treat or cure a disease sort of thing. In terms of just a multivitamin, I think that most of those you're not getting high doses of anything, so I think their side effect profile is very low. I don't think the same can be said for probably most of the stuff online where that hasn't even been tested and can be, adulterated with whatever, but also really high doses and people just kind of think like, oh, more is better because it's a vitamin, it's good for you or something, or it's herbal or whatever. So I think a lot of the misinformation in the nutrition space around supplements is kind of scary and it's very unregulated as well. And safety, and aside from just people wasting their money on something that's not going to do anything, safety is what I sort of see as the biggest worry. That and like foregoing traditional medicine and doing something alternative instead, that may be completely unfounded or, wackadoodle, for lack of a better word. But yeah, in terms of multivitamin, what recommendations there are, I think most, like American Heart Association and whatnot, and even, so Walter Willett has a Live Healthy, something, I forget what the title of the book is. It recommends a multivitamin as a kind of like reassurance if you want. But I think a lot of the chronic diseases we're facing today are not really micronutrient driven for the most part. I think they could be, but it's not because we're a little bit low in vitamin C. So, if there's sort of like assurance that's wanted, I don't see why not. They're usually pretty affordable. But that's different from food fortification, which typically targets things we actually would be pretty deficient in on a population level if we didn't have fortified in the food supply, is usually how those get into the supply.
I have time for one or two more questions.
I have a question. You spoke a little bit to the question earlier about, these flashy headlines from, the government perspective and trying to be like the more sound voice in the room, but competing against those like private industry headlines that are attractive to people's want of like hard and fast rules. I mean, the science shows there is no hard and fast rules about what you're eating in conjunction with maybe unhealthier foods or proportions, and you're already distilling thousands and thousands of pages of data into like a smaller bucket. But even still, like the dietary guidelines, people are like, this is still too much. Like, I just want someone to tell me what to eat.
Yeah.
When you guys are making those decisions about what to make simpler versus what to really push the nuance, I'm curious if you could like comment on what are the spaces we really want to have people think more nuanced on versus the ones we're okay being a little more simple on because people are attracted to simple.
That's a good question. I think that when it comes to fruits and vegetables, the nuance isn't as important. Like you'll get follow-up questions like, but what about organic? Or what if it's canned? Or what if it's frozen? Like if you're eating fruits and vegetables, that's fantastic. And whatever form it comes in is like a massive win because people are not eating fruits and vegetables. So I think it depends on where the gaps are. That it's like any way, shape, or form you can get fruits and vegetables in your diet, do it. And the nuance, you know, if we're at a place where everyone's meeting those goals and we can like work at the edges, then that'd be great, but we're not there yet. You know, I think there's a lot of like focus on labels and big words and the ingredient list and stuff like that maybe, you know, people can like want to be educated on. And maybe that's where some of the stuff you can't really get in these processed foods, like that much information on could be useful. But again, the dietary guidelines have recommended minimally processed whole fruits and vegetables for years, and it has not come in the form of ultra processed food guidance, but it's been, you know, sugar, added sugar, sodium, and added saturated fats have been the foundation of much of the guidelines for a while. So, you know, it's maybe not nuanced, but like keeping up with like the way people are interacting with purchasing and making these decisions and making it more like accessible or relatable instead of, you know, using science terminology. That might be one way. But yeah, I don't know.
Can I ask one? Is that okay? All right. First of all, this is fascinating. I want to thank you again, you know, for being here. I was actually going to ask a follow-up on kind of ultra-processed foods because at the last speaker in the series, we talked a little bit about that topic. Well, we talked all about that topic. And I guess I'm curious, you said there would be like other questions you would have liked to review. Would love to like know more about that. And then also, we spent some of the time in that discussion on just this definitional question around like, you know, the definition of ultra-processed foods that's being used, like the NOVA classification is so complex, and I think like from us, you know, looking from a legal perspective, it makes it hard to figure out how do you regulate. And I'm curious like whether that was part of the discussion at all, like you know, did you feel like there's like a challenge in kind of figuring out what's in that category and what's not, and you know, where do you think that'll go?
I mean, I think again, because we're looking at existing science, we have to go with whatever the research that's been done is describing. So if they say we use this definition of ultra-processed food, or we use NOVA, or we're just going to call it junk food, but it's essentially the same thing as NOVA 4, like that was part of the discussion for sure. I think I get why that can be frustrating or like sort of decrease how useful that concept is. But at the end of the day, I think we also know what we're all talking about, and it's like, I don't want that to be a reason we don't review the science on it, or why we don't consider its importance in our food supply or act on it from a policy level, because it doesn't really matter. There's, you know, still a truth to something out there causing obesity. You can call it whatever you want or classify it however you want. I also think the field is moving fast. Well, it's moving very slowly and quickly at the same time when it comes to ultra-processed foods. I think there's not a lot of trials coming out, which is probably where we really need to start investing a lot more, because it's going to come down to like manipulating very specific factors about these foods. Whereas if you look in the epidemiology, one reason why something like NOVA is so vague or frustrating is because it's just capturing everything. But that's because everything is ultra processed. So if we want to know what about it is sort of driving something like obesity, then we have to have more information than we can get at the food level. And that's information about additives or the processing or the way in which cellular structure is changed, even if the ingredient's the exact same. And so that, you know, is sort of a level of food science that we don't typically get in the type of data we work with, but I don't think it's impossible to get there. And so I don't know if I'm really answering your question as directly, but I think, yes, the conversation around ultra-processed foods and whether we should review those questions did bring up a lot concerns about the definition. I personally don't think that matters. I think we can, look at science around whatever definition is used and draw some conclusions regardless, because you can say the same thing about any food or any pattern, right? Like the Mediterranean pattern, that's defined in many different ways. I think it seemed like sort of a missed opportunity still. So I think someone also recommended the book, oh my gosh, I'm blanking on it. It was about the legal side of tobacco industry and also climate change. Drew a lot of parallels in my mind to ultra-processed foods, really the distractions that were put in place and like sort of discrediting the science, and if you create confusion around it, then you can buy yourself some more time. And I think that's a sense that I get a lot of the sort of discussion around NOVA is really just kind of like a big distraction from the science itself. But I get that, we can also be a little bit more specific at the same time, sure, why not? But we can all do all that in parallel. Yeah.
Thank you. Was the book Merchants of Doubt?
Yes, that's what, yeah.
Very interesting parallels, so highly recommend that one as well. Can we please get a huge round of applause for Dr.
This is really fun. I wish we had more time. We could probably talk forever. But that's not obvious.